Aloha, everyone. Next to June 18, 2026 meeting of the Hawaii Correctional Oversight Commission. See everyone who's here. Let me do a roll call real quick. I call this meeting to order. Mike Town.
Here.
Mark Browning. Here. Ronnie Barra. Here. Martha Cornet. Here. And Mark Patterson. Here. So, all present and accounted for. Thank you guys. Good to see everybody here. Mike's on virtual, and the rest of us are here in wonderful, beautiful Maui. So let's look at our approved. I'll take a motion to approve the minutes of the May 14, 2026 meeting.
So
Been moved by Martha and seconded by Mark that we accept the minutes of May 14, 2026. Any discussion? Hearing none, all in favor say aye.
Aye.
All opposed, same. The abstentions, motion pass. In our agenda item number 4, today the government, the state of Hawaii is having their
Department's having.
what's the department?
Yeah.
The department is having their incentive awards for their employees, where they honor their top employees and their teams. So we don't have any representation from the DCR today at this time, so we'll just postpone on item number 4 to the next meeting and move on directly to item number 5, the overview of the oversight coordinator. I'll be reading the report. It's a reminder to everyone that our oversight coordinator has been on maternity leave, and she should be returning at the end of July. In terms of death in custody, in May, we had 2 deaths to report on. A Korean male in custody, 64-year-old, was found unresponsive during a standing head count by OCCC. Security immediately administered CPR. Medical staff were called at approximately 6:06 p.m. EMS was called at approximately 6:15 and arrived at the facility at 6:20. The DCR records indicate that the decedent was transported to the hospital at approximately 6:40 or pronounced dead at 7:02. Autopsy will determine the official cause of death and time of death of that. And then on May 26, security staff at OCCC again reported receiving a call from a local hospital. The local hospital reported that a Vietnamese male in custody, 59 years old, passed away at 2:39 p.m. The decedent was reported at the hospital for a medical procedure at the time of the death. Autopsy will determine the official cause of death at that time. So 2 deaths in custody on a walk. There were no tours or events that the commission attended in this past month. Mind you, if you go to our website, you can find the oversight coordinator for the month of May on the website itself. We're happy to continue to talk about the system that we have in managing the complaints that were going on, so that we can give better reporting out and managing as the complaints come in. Currently, we have 248 pending, 109 cases open, and then we closed 76 cases in the month of May. Those are high numbers coming in at this time. Pending is normally just telling us we have received them, we logged them in, and as we close the open cases, we begin to bring more as we prioritize which cases are more important than others. Okay. Our complaints from the prison seem to be the highest at this point, Arizona being the majority of the complaints coming in at this time. All of this with the information in the database is going to help us with patterns and eventually give us a means of seeing how the systems or how the individual prisons are dealing with the issues that they have. So please read that in our monthly report as listed. And then once again, based on a custody report, and if you look at the oversight coordinator's report, you'll see all the numbers in the facility. We're still highly concerned with the empty beds at Waiaba and Kulani, and specific, as well as all our furlough beds in the jails on neighbor islands. And we're going to look at Maui today. We know what we saw the last time, so we're going to see if there's been any improvement in the vacancies of their furlough beds. We are looking at means and ways to ignite or light a fire under the DCR to say, hey, bodies need to be moved. Yeah. And we don't know why after a while, so many years that we've been telling you beds are empty, that there has been no organized plan or phasing to help understand why those bodies are not moving. And most of the answers we've been getting have really been shallow. So that's our oversight coordinator's report at this time.
Yeah, after they make their comments on it.
I'm going to open this up for public testimony. Anybody want to have a comment about what we just talked about in the oversight coordinator's report? Hi, Kat.
Unmute. You're on mute.
Aloha, commissioners. Nice to see you all. Hope you're well. I wanted to address the complaint system and the outrageous number of complaints from Saguaro. Many of them have to do with Jennifer Beckler, who is the Hawaii contract monitor, who can't seem to stay in her own lane. She keeps abusing due process rights of people who are incarcerated there. And she's actually intervened in HIPAA things. And I'm like, wait a minute, you have no right to actually intervene in, HIPAA violations. So this is a problem, and I've been getting lots and lots of letters from people who are really concerned because she seems to have no oversight and no guardrails. So I just want to bring that up, and I've brought it up in the past, that I would hope that when she comes to Hawaii for an annual visit, the Oversight Commission will work with the legislature to do an informational briefing so that families could actually understand what's going on. Thank you.
Thank you, Kat. Anyone else? Not seeing any hands at this.
Sorry, Richard, to your left. John Green.
Go ahead.
Ms. Higa,
Please, you- sorry.
and please unmute. You're on mute.
Okay, can you hear me?
Yes.
Okay, great. Okay, first of all, thank you for your folks' time. I know you said that DCR is not here today, but I was just trying to request simple food and safety inspection report. And that's
Ms. Higa, at this point, it's only to respond to the report we just presented. When we get you again, you can bring up those and we can add them to the next agenda.
okay, great. Thank you very much.
Go ahead. This commission, any discussion?
And the discussion I have is the tables we have in the back. It shows the minimum security facilities of Oyaba and Kulani and how under filled they are, how many empty beds there are. But I've asked the committee the staff to also add furlough beds. Because on this chart that I have in front of me, we can see that there are people who are community classified, which means they're eligible for furlough beds, but we don't have a listing for furlough beds. So we need to add that, how many are filled. When we were on Maui last year, there were only 3 furloughees participating. So we will be updating this of that in the future.
Okay, anything else, commissioners? Mike, you got anything to say? All right, let's move on to the next item on the agenda. Item number 6 is the Senate concurrent resolution 89 that was recently passed in the 26th legislature, and basically giving the chairmanship of an advisory committee to the Correctional System Oversight Commission, bringing together groups as listed to really look at the breaking cycles report done by the University of Hawaii, Kathy Shar, right? And why it's not for any kind of implementation going on with the current building of OCCC. Yeah. And if you look at the resolution, you will find that there is a lot of organizations that are placed on this advisory group. Many of them are community Hawaiian organizations. Yeah, I think the intent of the bill, of the resolution, was to have a discussion to assure that we can weave in the recommendations of the breaking cycles into the building of the new OCCC, as well as the implementation of Hawaiian programming, Native Hawaiian programming and culture into this. I think the entire system,
Yeah.
rather than just the jail. So that's kind of where we are right now. We are reaching out to the organizations that are listed in that resolution to find who can attend the meetings, right? That's a process, and I don't think some of these organizations don't even know that they're on this list. And then we are looking at having our first meeting when our oversight coordinator returns at the end of July. Yeah. So that's where we are with the concurrent resolution. I'll open it up to any testimony from the public pertaining to this resolution. Seeing none, commissioners, any discussion?
Mark, Mike Town here. I don't know where this fits in. I've received several calls, and we can push it back if you need to. There's a big concern about setting mandatory minimums. Is that for the judges? Is that for the paroling authority? And then at the end of I was, as you all know, I was on the parole board for 8-9 years. We would entertain whether we should reduce a mandatory minimum. It seems to me there's very poor due process on that. We need to have a calendar and attorneys present. So I just want to let you know the attorneys are they're on this. They're figuring it out fast, and we need to address that at some point, because a mandatory minimum that doesn't make sense is not very helpful. And we would periodically reduce them, but seldom. So I just want to raise that, Mark. Where does that belong in this whole agenda?
Right now, those kind of concerns, Mike, as a commissioner, you can write a summary of what your concern is and send it to the oversight office. We can give you all on that for you. Okay. And the majority of it, I mean, he just heard what you just said. I don't know if it's recorded. Yeah. But just remind us that what you said, and we can follow up for you, okay?
So I should tell the attorneys if they have a concern, they should write it to the oversight coordinator. Is that right?
Yes.
And I've communicated that, and I know that from my own experience. So it's something we really need to address, and it's just not right. Thank you.
Thank you.
I want to make a comment on that. Mike, I was never under the impression that the paroling authority had the paroling authority could override a judge's set mandatory minimum, which is by law. It's not in the hands of the judges completely, it's by law. And so I don't believe that the paroling authority can lower a mandatory minimum, have to go back to court.
Well, good point, but we will get an open term, and then it's up to the parole board to set the minimums.
There's a mandatory minimum. The parole board could not set their minimum below the mandatory minimum.
I didn't mention mandatory. I said the minimums were set via administratively by the parole board.
Oh, okay.
And then we'll tell them, you can come back and we'll consider reducing your minimum. That is not right, and it's not legal, I think. And the attorneys are onto this, and so they're now posturing cases on appeal, Martha. And it's so I agree. We're not talking about judges. We're talking about the parole board reconsidering sometimes very draconian minimums.
Yes.
Okay. So I want to end that conversation real quick. We don't have oversight over the Hawaii Paroling Authority. Okay. But however, there may be a move that at some particular point in time for the 27 legislature, how we can put the Hawaii Paroling Authority under the mandate of the Hawaii Correctional System Oversight. Yeah. So I'll just say it at that. And when they can become part of our mandate, then we can have some oversight over what they do. Till then, we don't. In regards,
I want to say something else on that the paroling authority, being that our commission is responsible to be helping with re-entry, we think it's really appropriate the paroling authority ought to be under us, because they're the ones that determine when someone will actually get out.
I mean, it makes sense. They're part of the system. Okay. And to close out the HCR SCR 89 report, so we can move on to the agenda. It's when we're looking at having discussions, create recommendations on how we can weave together the breaking cycles report and the current OCCC plan. And so I want to say, even before the meeting started and whatnot, it's really, and Kat, you can kind of nod your head so I know I'm on the right track. It's really about how do we make them follow the recommendations. Yeah, there's been so many recommendations to public safety and PCR over the last 15 to 20 years, and none of them have ever been followed. So the key is really not so much in trying to change anything that's already written in the breaking cycles of what's going on. It's really about how do you influence the leaders. What legislative action is going to force the collaboration and the transparency of the building of the new jail and weaving in of the breaking cycles that the community put together. That's my thought right now. I'm throwing it out there so we can have a discussion, because it's going to take an executive leadership. You need transformative leadership in order for system change to occur. And multiple state systems. Okay? And we're talking top heavy. So thank you everyone for that discussion. Let's move on to public comment. We'll open it up for anything that's not on the agenda. Ms. Higa, I'll start off with you. Thank you for waiting.
Hi. Okay. Well, thank you very much, first of all. And I just want to say, I just want to find more transparency. Like, I don't know how I got this far. I never imagined it to be so hard to get simple health records, like just the water and like food. And we have went through so many avenues, offices, giving them time limits and following all the rules, and nobody can come up with no records. And it's kind of scary because it is pointing to one side, and I don't know what to do because I have fear for people inside behind the own prison. So I'm trying to protect them too, but this is how far it has gotten. And I think a oversight on all of the like state people would just be great, because it seems like everybody knows everybody, and somehow records are being missing or gone, or they just can't find it. And there's no explanation. I just have to try, because then I know we have tried over 6 different offices. We went to the news action line. We're just trying to reach out, and we just don't know how.
What is the individual concern?
Well, it was because of inmates of all different ages at all different times with the same medical itchiness that is being diagnosed as I put together all of them stories, and they all say they was diagnosed with being mentally ill. So then I was trying to figure out, is this a medical issue? Is this because of the food? And maybe even the water system, it just could be hooked up to the other side where. So I went to Department of Health, and they told me that they haven't been doing inspections there for like the past 4 years, and they will not be handling it. So I want to know, yeah.
You know what would be a real great help to us is everything that we've gotten down in a report of how you've picking it up so far. Email it to the website. Or
Yes.
email. See. SOC@hawaii.gov.
I think I have. I made 2 reports. I sent in all of my different contacts. I sent in mail, certified mail, and it got sent back unsigned. And still nobody couldn't do nothing for me. So then I went to OIP.
Give it to the Hawaii Correctional System Oversight Commission.
They said Tommy Johnson is not there, and so nobody could even sign for it. So they just basically sent it back unsigned,
Okay,
and that's it.
Well, please provide us with copies.
Yes. Okay.
Thank you.
thank you.
Bye-bye.
Any other testimonies? Go ahead, Kat.
Unmute.
I just want to again ask the commission to ask the department when Miss Beckler comes for her annual meeting that they hold a public informational briefing with a legislator. Thank you.
Okay, I'm gonna bring something up. We did have testimony submitted to us by Dr. Keeney, and she asked we added to the agenda the restrictive housing bill, and she particularly wanted us to, it states implementation data analysis update, including how prolonged restrictive housing will be identified and reviewed where formal classification labels may not reflect the actual safety related reason, including the incarcerated state witness. I want to stress that the restrictive housing law is a multi-year implementation, and the department is to begin at July 1st of this year. So there's nothing for us to look at yet. We have not seen the policies. Of course, we will ask for them in July. We need all the information we have on this. There is a role for for our commission to participate in this, and in the bill, it's found on page 19 and 20. And it says, following the initial hearing for placement of individual into restrictive housing, the department shall immediately notify and transmit all relevant documentation to the Hawaii Correctional System Oversight Commission. And then the Correctional System Oversight Commission shall actively monitor and review all housing placements. Whoops, this page of the individuals who are subjected to this. So we are still working on this. And again, it has not started yet. There is a working group that has been established also that is being chaired. The working group is primarily to focus on special needs inmates. And Representative Belatti and Senator Fukunaga are the chairs. Mark has been assigned from the commission to attend these meetings, but they have had only 2 meetings so far this year. So there's not a lot to report from that. And the working group is resolved January 8th of 2027. So they have to have a report by December of 2027. The DCR was to submit reports to the legislature and the commission prior to the 2026 and 2027 legislative session. I reviewed all the reports that were submitted to the legislature and did not find that there was any report submitted on that. So we will follow up on that. And then on January 12th, 2028, DCR is to submit a final report about implementation. So again, this is an ongoing process and our role is just beginning next.
Go ahead, Kat.
Community Alliance on Prisons and OHA are community groups that are part of the working group for the solitary confinement restrictive housing. And I can say that Rep. Belatti has basically turned that meeting over to DCR, who basically talk about all the stuff they're gonna do. And people are dying. People are dying in restrictive housing. And I cannot believe that they're ignoring it. And so I really hope that when the meetings start again in July, that I know I'll be bringing it up, that we need to know what is happening now and why are people committing suicide? Something is deeply wrong and they only want to do what Rep. Bellatti's law firm is working on, mental health. And there's a whole other host of things going on. So it's been a very, very, very frustrating experience for the community. Thank you.
Thank you.
I have another comment too. People have been very concerned about the CHIP program in Arizona, as we are. And this law will apply to Arizona. It has been a wrestling match for us to even get the policy from Arizona, but I believe we're seeing breakthrough and we will be getting, I am hoping we'll get it in the next few months if we get the policy. So I want you to know that this law does apply to Arizona.
I appreciate you guys. Thank you so much because we've been out here like fighting this for years and we really, really appreciate you. Thank you.
Appreciate you too, yeah, and all of you in the community. Thank you, folks. Our next scheduled meeting is for Thursday, July 9th, 26, and we'll be visiting all community correctional settings. So we'll be back at our office on July 9th. We just want to announce, starting July 1st, we'll be opening the position for the reentry oversight specialist. Yeah, we'll be looking for one more staff member to join us.
So if you know good people out there that can help with that, please steer them our way so they can apply for the position.
And we weren't able to go to the Big Island last month, but we will look at revisiting it in August and we'll make that announcement in July. Commissioners, any other thing you guys want to talk about or announcements? Seeing none. Thank you, everyone. Folks, have a great day and we'll see you next month. Mahalo.